Okay, good morning. It's Dr. Deuk at the Deuk Spine Institute. I'm here with one of my lovely patients who just had Deuk laser disc repair on her lower back. And she's coming back 4 days after her surgery, which was done 4 days ago, outpatient. You went home the same day. You were doing great 4 days ago. How are you doing today?
Excellent. Excellent.
All right. So expound on that a little bit. No pain in your back.
No pain in my back, no pain in my leg. Hip's a little tender, but that's another issue.
Yep.
Excellent. Getting
So you're
around
happy?
fine. Very happy.
All right, good.
Very happy.
So you had, sorry, go
Best
ahead.
thing I ever did.
All right. So I don't know about best thing you ever did. I've got a lovely husband here. I'm sure they did a lot of fun stuff. But you're happy that you took the initiative. You got the surgery done. You were probably apprehensive about it, like everybody is, worried about surgery. But we got through without any complications. And the back pain you had before surgery, the reason why you came here, your back and right leg pain, you're saying is
Completely gone.
completely gone, cured.
Completely gone.
Cured. Yeah. So curing back pain is possible as long as you get the right surgery. What surgery did you have done?
The laser.
Deuk laser disc repair. Good. All right, that's okay.
That's it. I just wish I would have come 3 months ago.
Yeah.
You know, earlier on, and just skipped everybody else and just came here first.
So what is this everybody else? Was that other surgeons you went to see? And what did they tell you?
That I needed a laminectomy, and I didn't want a laminectomy. I didn't want my back all cut up. I didn't want bones cut. I want to go in, get it over with, and be able to walk right away.
Yeah, laminectomies don't fix back pain. They fix leg symptoms, maybe. So it's a much worse surgery, and it won't be as gratifying. What else did they offer you besides laminectomy?
Cortisone shots?
Okay. What about a fusion? Did anyone talk to you about a fusion?
No, they said my spine was stable enough. I didn't need it, but you know.
Well, you had back pain, and that's instability usually. So, did you encounter any surgeons that said you don't need anything done at all?
Oh, you know, they wanted to kind of beat around the bush first, and I didn't want to wait. You know,
Understood.
I had one cortisone shot, didn't even touch the pain, didn't even phase it.
Yeah.
So.
All right. So, what's the plans for the holidays? It is, after all, what, December 23rd? What are you guys doing?
My daughter's in town, and we're gonna have some fun, and I'm gonna make her cook.
All right. Very good. You're gonna milk it for all it's worth, right?
You bet. Yeah, I've done it for a long time. It's her turn.
All right. Anything you want to say to the world before we shut down?
This is the place to come if you have any spine issues. So this is the place.
Thank you, sir. Do you want to say anything?
Yeah, it was great coming here. We're really thankful that we found you. You know, we did our research. We went to, the big name hospital, and the pain management guy said, well, you need surgery, and the surgeon guy said, you need pain management, and then we're going to do the laminectomy, and it really, didn't feel right. We came here, we knew about your procedures, and we talked to you. It was exactly what we wanted. So,
All right.
we
Well,
were
thank you. Thanks for having the confidence in us.
Absolutely.
Yes, very much so.
All right, go enjoy
Very much
life,
so. Oh, yeah.
okay? All right. You guys don't